Osteopetrosis, the marble bone disease. This is Samantha Lopez.
Anatomy and characteristics of osteopetrosis. Osteopetrosis, which is also known as Albert-Gomberg disease or marble bone disease. Bones become too dense but can break easily because new bone grows faster than old bone is removed. It is characterized by hard, dense bones due to the failure of osteoclasts to reabsorb bone, leading to impairment of modeling and remodeling. 3 types of osteopetrosis include infantile, intermediate, and adult onset. In majority of the cases, it is with a fracture due to the weakened bones, and there is also crowding of the marrow, so bone marrow function is affected.
All right, this is Faith Morris. These are the signs and symptoms. 80 to 90% of people with osteopetrosis have abnormal cortical bone formation, abnormal cranial nerve formation, abnormal pelvic bone ossification, abnormality of the ribs, abnormal vertebral epiphysis formation, and other signs and symptoms include bone fractures, low blood cell levels due to the impairments in reabsorption, vision loss, hearing loss, and dental problems and infections. Effects on normal structure and function. Issues with bone marrow cause many problems such as low levels of white blood cells, reduced ability to fight infection, low platelet levels impair coagulation and ability to control bleeding, low red blood cells level impair ability to carry vital nutrients and oxygen to cells in the body.
My name is Cassidy McKegg, etiology. So osteopetrosis is a genetically inherited disease. It is usually caused by a genetic mutation in one of 9 possible genes that are involved in the formation, development, and functioning of osteoclasts. These 9 genes are the CA2 gene, the CLCN7, the IKBKG, the ITGB3, the OSTM1 gene, the PLEKHM1, the TCIRG1, the TNFRSF11A, and the TNFSF11. So mutations in any of these genes result in a defective or missing osteoclast or multiple osteoclasts, which causes an impairment in bone resorption. But in 30% of cases, the cause of osteopetrosis is unknown. So the inheritance pattern of osteopetrosis can be autosomal dominant, which means that the gene mutation is inherited by one parent with the disease, but it can also be autosomal recessive inheritance, which means that both parents are carriers of the genetic mutation, even though neither show any symptoms of the disease. But in majority of cases, mutations in the CLCN7 gene are responsible for about 75% of autosomal dominant osteopetrosis and 10 to 15% of autosomal recessive osteopetrosis. Mutations in the TCIRG1 gene are responsible for about 50% of autosomal recessive osteopetrosis. Additionally, osteopetrosis can be X-linked recessive, which means that there is a sex-linked correlation with the inheritance pattern, which is because the IKBKG gene is located on the X chromosome. So since males are XY, only one gene mutation is necessary to cause symptoms of osteopetrosis in men. But that genetic mutation can only be passed down from the mother because of the X-linked recessive nature of inheritance. On the other hand, in females who are XX, a mutation has to occur in both copies of the gene in order to cause symptoms of the condition, meaning the female inherited the gene mutation from both parents. So what this all means is that males are more frequently affected by the X-linked recessive type of osteopetrosis. So statistically, autosomal dominant osteopetrosis is the most common form of the disorder, and it affects about 1 in 20,000 people worldwide. Autosomal recessive osteopetrosis is rarer. It only affects 1 in 250,000 births worldwide. There are particularly high incidences of osteopetrosis reported in Costa Rica, and they're about 3.4 in 100,000 births that it occurs. There's also higher incidences reported in the Middle East, Sweden, and Russia. But there are a few other forms of osteopetrosis, and they're very rare, and so there's only a few cases that have been reported worldwide in medical literature. As far as national statistics in the United States, approximately 8 to 40 children in the United States are diagnosed with malignant infantile type osteopetrosis, which is a subcategory of osteopetrosis. And adult type osteopetrosis affects approximately 1,250 individuals in the United States. The U.S. incidence rate is about 1 in 20,000 individuals in the U.S. nationally.
This is Cameron Rushing, and this is Diagnosis. Diagnosis is primarily clinical and based on radiological imaging, features of the skeleton, diffuse sclerosis, abnormal hardening of pelvis, skull, spine, and appendicular bones, bone remodeling defects at metaphysis, where growth plates are, of long bones, i.e., funnel-like appearance, bone-in-bone appearance in vertebrae and phalanges, presence in lucent bands, glowing appearance on radiological images. Methods of diagnosis. Genetic testing can identify the affected gene in 90% of cases. Bone biopsy can be performed to confirm the diagnosis, but it's rarely performed due to the invasive procedure involved. Once diagnosed, the following blood tests are routinely drawn to determine a course of treatment. Functional brain MRI to evaluate cranial nerve involvement, hydrocephalus, and vascular abnormalities. Bone marrow transplant. This is a nice picture of methods of diagnosis to pelvis and hips.
This is Madison Johnston, and this is the treatment. Infantile osteopetrosis warrants treatment due to the adverse outcomes that can arise. There is no treatment for adult osteopetrosis, but some complications may require intervention to lessen the effects. In pediatrics, surgical intervention is often needed for fractures. With adults, surgery is only used for aesthetic reasons such as facial deformities and functional reasons such as loss of function. A calcium-deficient diet can improve patient growth. Medications that are used for treatment for mostly infantile osteopetrosis include vitamin D supplements, corticosteroids, erythropoietin, and gamma interferons. This is Faith Morris. The prognosis, what happens if the patient receives treatment? In infants, if treated, there can be a significant change after bone marrow transplant. In some cases, osteopetrosis can be cured if the disease is early onset. In adults, they don't normally receive treatment, but quality of life can be improved. What happens if the patient goes untreated? In infants, not treating osteopetrosis usually causes death by the first decade of life. Death can be caused by anemia, bleeding, and infections. In adults, symptoms can worsen and eventually lead to death.